more common questions I hear from my senior patients is, "Doc, why are my eyes always running water?" The answer to that question usually sounds like a bit of a paradox. You probably have dry eye syndrome. So how can that be? Well, we all have two types of glands that supply tears to our eyes. One type provides basic tears with just a small but constant flow, just enough to keep the eyes moist. The other type flushes the eyes with a gushing overflow of tears whenever there's pain or irritation. As we age, the basic tears decline, often causing dry areas on the surface of our eyes that periodically signal the flushing gland into action, which makes the eyes wet again, but only for a while. Dry eye syndrome can be treated, so if your eyes seem to be frequently wet, visit your eye doctor to find out if you might actually have dry eye syndrome. Another question that I hear from my senior patients is, why do my eyes itch, or what makes my eyelids twitch? The answer to both of these questions is usually allergy. When the air is filled with dust, pollen, pet hair, or even the particulate from red tide, the result can be an itching eye surface. Our bodies use a special substance inside called histamine to dilate blood vessels in response to some type of injury or irritant. When we're allergic to a substance, our bodies overreact and release much more histamine than is required, which causes itching, swelling, and sometimes will also act on our eyelid muscles, causing them to twitch. Fortunately, there are a number of excellent antihistamine medications available, and some very good oral medications as well. So if your eyes are itching or twitching, you may want to see your eye doctor to find out if medication could help your symptoms. Many of my senior patients wake up each morning with their eyelids sort of glued shut. This sticky problem is usually caused by an overabundance of bacteria on the surface of the eye, an eye infection. Now, our eyes try to fight the infection by trapping the bacteria in a sticky mucus discharge. And so the lids may want to adhere to one another. Infections can be minor or they can be serious, depending on the bacteria causing the problem. Sometimes just a little hygiene is needed to restore the proper balance, but sometimes it takes medication to eliminate those harmful germs. And it's certainly not normal to have the eyelids sticking together each morning. So if that sounds like you, see your eye doctor to get appropriate treatment. If you watch television regularly, you'll eventually see an advertisement for an eye drop that is supposedly good for your eyes because it gets the red out. These types of eye drops are misleading and may not actually be your best choice. If your eyes look red, your tearing system is there to flush the eyes with clean, healthy tears. So they should improve on their own very quickly, unless there's some medical reason. The cause might be allergic, toxic, bacterial, viral, or even traumatic. Most of the get the red out drops contain vasoconstrictors, meaning they cause the smooth muscle in the blood vessels to constrict and look temporarily smaller. Because they fatigue that smooth muscle, the eye will often look even more red after the medication wears off, which may prompt another dose and another. Now, these drops don't address the cause of the problem, they just cover it up. Also, they contain strong preservatives so that they can be sold on the store shelves for many months. And since many people are allergic to those preservatives, they can actually make the problem worse rather than better. So if your eyes don't improve on their own within a few hours, you should probably see your eye doctor rather than run for the drugstore. Do your ears hang low? So what do ears have to do with eyes? Seniors especially have a hard time using their bifocal eyeglasses if they have ears that are positioned a little lower than average. This will often cause the eyeglasses to tilt away from the cheeks at the bottom, which in turn causes the vision to be distorted through the bifocal lens. In order to see clearly through our bifocals, the glasses should be adjusted so that the bottom of the lens is slightly closer to the face than the top of the lens. This will provide the correct angle for best vision. Now, this is just one of several factors that can all have a bearing on how well our eyeglasses perform for us. But it's also one of the most common to be overlooked, even by professionals who should know better. I've often encountered seniors who said, "I just can't see with these bifocals." And all it took was a small frame adjustment to make them work perfectly. So if your ears hang low, your nose is big or small, or your eyes are uneven, or your eyebrows are prominent, trust me, you are normal. You just need to work with a caring professional who can help you select the eyeglass frame that works best with your features. If you'd like more information on common eye care issues, please go to lifetimevisioncare.net. I'm Dr. Phillips of Lifetime Vision Care with HealthBeat.